that psychologist? Is he trying to shrink my head or get into my mind? And so I think playing along with them in the context either inpatient or outpatient as a clinical application is recommended.
Definitely. Well, thank you both very much. I know we have more questions, but I believe we'll go ahead and save those for the interactive discussion this afternoon, just so we can stay on schedule. So, thank you again, Michelle and Eric. And now we'll be moving towards the second presentation of the day, and we'll hear from Joy Hammel and Lex Frieden, and they will talk about the Americans with Disabilities Act Participatory Action Research Consortium, or the ADA-PARC, and their interactive data displays of community and work disparities. So Joy, Lex, are you ready to begin?
We are. Thank you very much, and thank all of you for joining us today. I'm Lex Frieden, and I'll make the first part of our presentation, and my colleague and esteemed researcher, Joy Hammel from the University of Illinois at Chicago, will take over partway through the presentation, and we'll be glad to respond to any questions that you all may have in the process. I also want to thank, before we get started, our colleagues at AIR, particularly Kathleen Murphy, who works with us on a number of projects, for their efforts with this series, and special shout out to Pimjai, our project officer, who's a great supporter of our program. We appreciate that very much, and we certainly appreciate the funding that we receive from NIDLR. So I'll go through a little preliminary information here. Next slide, please. You have before you a set of learning objectives. We hope that by the time this presentation is over, you'll be able to check those off and see that we met our objective and yours as well. Next slide. The $64,000 question here is, why should we be concerned about health and participation disparities experienced by people with disabilities? I'll not try to answer that question right now. I'll leave it to you to make the judgment about that. But first, please take into account our presentation to follow here. Next slide. The Americans with Disabilities Act was precipitated by a lot of knowledge awareness by people with disabilities, beginning following the Vietnam conflict in the late 1960s. A number of disabled veterans came back from Vietnam, and they weren't happy with the treatment they received, or lack thereof, when they got back to the States. Many of them with disabilities that we haven't seen produced by war before, many amputations, spinal cord injuries, and others, head injuries in particular, were coming back, and they didn't get a very good reception by employers, and frankly not even by the society in general. They were excluded from many public places and public programs, as well as the opportunity to work, and they joined a large number of civilians with disabilities who had been frustrated by the same barriers. So in the early 1970s, which was a time of activism among people with disabilities and people of color and women in the United States, people with disabilities began to join demonstrations, make protests, create public actions, have marches, rallies. We did sit-ins in federal office buildings, and we were rewarded early on by the passage of the Rehabilitation Act of 1973 that included Title V provisions preventing discrimination among federal programs. However, those provisions were never enacted early on. They weren't implemented because there were no regulations. And 4 years in, people with disabilities, principally led by the American Coalition of Citizens with Disabilities, began to develop a national program of advocacy that would eventually lead to signing of regulations to implement Title V of the Rehabilitation Act of 1973. Now, unfortunately, we were not able to include a number of enlightening graphics and videos for this presentation, but let me refer you to YouTube, and if you all will make note, you can Google up the disability movement, where we've been and where we're going. You can Google that along with my name, and it should be the first thing that pops up on YouTube. Please have a look at that. It's a 50-minute video that talks about the history of the ADA, and I think you'll find that enlightening and supplemental to the basis of the research that we're going to describe today. Next slide, please. So the ADA was eventually passed and signed by President George Herbert Walker Bush on July the 26th, 1990. We are now 25 plus years into implementation of the ADA, and from time to time we ask ourselves what the impact of the ADA has been. Last year, my colleagues and I at ILRU, in cooperation with the ADA-PARC program, did a survey of people with disabilities, leaders in the disability movement around the United States. We wanted to know what full participation in society looks like 25 years post-ADA. We wanted to understand how far we've come. We wanted to know what the key issues still remaining are, and we wanted to find what kinds of strategies advocates and others could use to fully implement ADA and address the issue of disparities between our population and the general population. Next slide, please. The results of that survey were enlightening. First of all, we found that people with disabilities, leaders in the disability movement, were quite pleased with some of the progress we've made, and they in particular found progress in the area of access to public accommodations to be particularly well done. People now can get into most every public place, regardless of the type of disability they might have. Many accommodations are made in terms of entries, in terms of navigation, in terms of access to bathrooms and other facilities within buildings, and this is likely to be the case that creates fewest impediments to full participation by people with disabilities. We receive very few complaints about those kinds of access issues. I would say the one outstanding issue with respect to public accommodations may well be parking, and we'll talk about the implications of that later on. So the next slide, please. In addition to understanding what the progress that we have made has been, we wanted to know where the lack of progress has been. And people with disabilities who are leaders in the movement generally said employment is one of the largest gaps, if not the largest gap, in terms of full implementation of ADA. They also noted quite frequently health care issues and housing access issues. I'll comment on each one of those. We know that the employment rate among people with disabilities varies between 75 and 90%, and it's quite high given the number of people with disabilities in our economy who wish to be employed. It probably is the greatest disparity that we can identify. We'll again talk about the more recent data later on. But employment barriers for people with disabilities are still quite significant 25 years after passage of the ADA. People were also concerned about access to health care. Now, that actually has improved since the passage of the Affordable Care Act. As you know, there's a number of complaints about ACA today. But as far as the population of people with disabilities are concerned, ACA has given us a great deal more confidence in the healthcare environment, and many people with disabilities who before ACA were not able to be insured through private programs are now being insured due to the provisions related to pre-existing conditions. Housing access, it remains a great barrier for people with disabilities. And while housing specifically is not addressed in full by the ADA, it is covered by the housing provisions of the Civil Rights Act that are modeled after the ADA provisions. And the barriers there relate to transition from institutions to the community. People, advocates, independent living centers who are working to transition people into the community are frustrated by the lack of housing access in their communities. Next slide, please. The major barriers to ADA implementation, most people would agree that enforcement is the #1 barrier to ADA implementation, but you'll see the data varies. Next slide. In order to look more carefully at the disparities between the population of people with disabilities and those without, we put together a program that NILR kindly funded. The co-principal investigator on this program is Joy Hammel from the University of Illinois at Chicago, and we have about 11 partners who are participating in ADA-PARC. This program is designed to tap the wisdom of people with disabilities in a participation action research paradigm to determine where those disparities are and to target certain kinds of solutions to reducing the disparities between people with disabilities and the general population. Next slide, please. Our funding, as noted, comes from NILR. Next slide. And we have a number of partners who play a crucial role in assuring that this really is a participatory action research program. It's a consortium not only in name but in practice. Next slide. We've lined out the purpose of the ADA-PARC. Joy may elaborate somewhat on this, but it's important to know that our goal all along has been to provide information that advocates may eventually use to help target ADA gaps and to aim for the work that we're doing toward more effective advocacy. And because of that, we have a number of the regional ADA centers involved intimately in our work. Next slide. We wanted to target a number of issues in particular. I'm going to turn it over to Joy now and let her elaborate, but we really do appreciate, again, your participation in this call, but also we look forward to continuing our dialogue with you as we go forward. Joy, take it away.
Thank you, Lex. So I'll just follow up from what Lex is saying about the ADA-PARC. He already gave you some data on the ADA survey of Centers for Independent Living, which is one way of translating knowledge back to the community, specifically to Center for Independent Living directors and their audience to see the impact of the ADA. But what we also wanted to do, again, with the 25th anniversary, now 26th, of the Americans with Disabilities Act, is we wanted to give communities, cities, disability communities, policymakers, a way to actually see how are we doing post-ADA. And specifically, we're focusing in on 3 different areas of participation. Specifically, that's community living, e.g., are people able to live in least restrictive settings of choice in the community, and do they have the supports to be able to stay there? The second area is community participation, e.g., are they able to get out of the house and actually get into that neighborhood and explore it and use it and shop in it? And then the third area for us is looking at work and economic participation. Again, this will get at employment, education, but also issues related to poverty and cost of living and what's happening with people with disabilities. You can see on the top of this slide the website for the ADA-PARC project, which you can click on, and then when you get there, it'll give you a very interactive display of all 3 of these. I'm going to step you through each of them, though, so you can kind of see how are we trying to translate knowledge back to people. So one of the KT methodologies that we're really using is GIS mapping, visualization, visualizing what the disparities actually look like in these 3 areas of participation. But along with that, we're also then trying to model how to display it in accessible ways. So what you're seeing here is a GIS map that shows you visually. So if you are a visual learner, a visual person, You can look at this and begin to see people with and without disabilities fairly quickly. If you go to our website, though, right underneath it is an accessible table version of this that also gives you the same information in an alternative format. So this GIS mapping and these tables help us to visualize and analyze some of the patterns and trends of what's happening and send it back to people in a way that they could use it. A second methodology that we're using from a knowledge translation perspective is indexing and benchmarking. Again, we're taking cues from the public health world, where you see a lot of these scorecards, right, that you see on health insurance, on livable communities by AARP, many other things out there which aren't disability specific in many cases and often aren't disability inclusive in their design or in the people that they're representing in the data. So we wanted to use that same concept of benchmarking, scorecarding, and take the data that we're working on and give it back to people, again, in another way that they could understand. And that, in this slide, you see kind of where we're headed with that. And that is, we're converting it to a 0 to 100 score, just like you would in a classroom test. We figured people would be able to understand 0 to 100%, 100% being on each of these social determinant of health, community, environmental variables we're looking at. Where is the best opportunity, which cities and which states have the best opportunities. 50% would be you're right in the middle, 0% is least opportunities, and that's where you would really be looking at disparities analysis and trying to target that. We wanted a tool that people could get at disparities and promising practices. And then the third methodology we're using are risk ratios. Again, coming from public health, we're looking at, again, a population-based way that's familiar in the world to show these things about the disability community too. So what a risk ratio allows us to do is compare people with and without disabilities on the likelihood of any kind of participation disparity in our three areas. So an example here is the likelihood of living in poverty, that it's almost 262% more likely that people in Washington, D.C. With disabilities are living in poverty compared to people without disabilities. And so again, risk ratios are another way to give a very compelling case to policymakers that they can say, wow, 262%, that is an issue we need to focus in on. So again, another part of our knowledge translation is we've developed across all of the ADA centers that are our primary collaborators. Each of the ADA regions that we're in also has community advisory boards that they've put together, and they're located throughout all of their different states. Those advisory boards also told us which cities we should start with. We wanted to model this, make sure the data was rigorous, clean. We wanted to have it tested on accessibility and usability whenever we were doing it. So we asked each of the regions to give us like 5 to 6 cities that they thought were representative across their region, that we could look at these 3 areas of participation, disparities, and opportunities. And so you see here the list of cities that began with us, and now we're adding in a number of many more cities to it. So let me take you through some examples so you can see how the KT works. That first area that I was talking about is community living findings. And primarily this is looking at, we really wanted to dive into issues related to Olmstead decision. You know, e.g. post-ADA and the Supreme Court Olmstead decision, what's really happening with people with disabilities in terms of their ability to actually access least restrictive community living, so outside of an institutional setting. And so when you go to the website, you will see a whole series of different indicators. I'm only going to show you just a couple of them today. That give you a different perspective, each one telling a story about this least restrictive community living. The slide you're seeing here is a GIS map. Again, on the website, there's an accessible table that goes with this that tells you the percentage of people with disabilities living in institutions. The darker the color on the map, the more percentage, the higher percentage of people that are living in institutions in this. So again, the visual maps allow us to compare different states by quarters, who's in the best quarter, who's in the bottom quarter. This next one is another indicator of community living, and that's the percentage of people with disabilities who want to get out of nursing homes according to CMS. And these are actually a very conservative estimate because they're actually asked by the nursing home, do you want to leave? And you can imagine there's issues with that. But even on a conservative basis, we can use this as yet another indicator of where are some of the disparities. In the darker color states here, you're seeing a greater percentage of people who want to move out. Now, this could mean that there's greater disparities in those states, or it could also mean that these states are increasingly making people with disabilities in nursing homes more and more aware of their community living options, right? So we want to keep going and look at some other things here too as indicators of community living participation. And this next slide tells you the picture of where is the money going, which is another big indicator, right, of disparities. So this slide shows you the ratio of home and community-based waivers, e.g. money being spent by Medicaid on community-based living with supports, as compared to institutional spending. So the darker the color on this means the greater percentage those states are actually spending on community supports. And the data you're seeing here is from 2013. If you go to our website now, all of these have been updated to 2014-15 data, so that gets constantly updated for us. But you begin to see here where's the states, and you actually see visual patterns of, which sides of the country are there belts, in the country of states that are grouping, that are spending far less money on community and much more on institutions. Again, another way to get this data out to people in terms of community living disparities is to give that scorecard or the benchmark. And what you're seeing here now is across all of these indicators, right? We have all different kinds of indicators of community living. If you look down in the yellow in the bottom of this graph, you'll see a composite score, basically your scorecard. Again, 100% meaning these are the best states. In this case, we also have it at a city level. And down to 0% is the states that are having the most issues in relation to community living participation. So this is a tool that the states are actually already using, and the cities even more so, to actually say, why aren't we in the top 10 or the bottom 10? Why can't we move out of the bottom 10, and how do we do it? And that's where we work with the ADA centers to take it back to our community advisory board that's made of consumers and policymakers who are then tackling these issues at that state and city level. Just to give you another example, work in economic participation is another area that we're looking at. Again, you can see the data here on people with and without disabilities. Again, striking when you have the GIS data and the tables right next to each other. To be able to see the disparities, the stark disparities that people with disabilities who are in the working age have related to employment. But we need to learn more about it to be able to understand it. When we actually look at how many are unemployed, it's not that big of a difference between people with and without disabilities. So that alone isn't explaining the disparity here. But now let's look at it in a different way, and that's how many people have actually left the whole labor force, e.g. they're not looking anymore. They've fallen out. They're not pursuing employment at this time. And here's where you see it in a very striking way from a knowledge translation about here's where the issue is for people with disabilities, that they're not in the labor force at this point. And so it's an issue of tackling that. How do you get people even to begin to get back into thinking this is possible and to be getting prepped for that. This next graphic that's here also tells you then, so then what happens when they're not working? And this gives you a demonstration of percentage of people with and without disabilities who are living below the poverty level. Again, people with disabilities on the left, people without disabilities on the right. And here's again where you see this striking disparity of the much greater percentage, much greater risk ratio for people with disabilities to be living below the poverty level. So it's not surprising when they're not participating in their communities, when they're living on that kind of an economic index. Here you're seeing the scorecard again, the benchmark, right? This is where we can combine all these different work and economic indicators And if you look down at the bottom, you can see the states that are doing the best and the worst related to issues of employment, unemployment, and poverty. In this grant, in this picture, we also have this same data at the city level, because sometimes data is important at the state level, and some of the Olmsted data we can only get at the state level. But sometimes you need to drill all the way down to a city, and sometimes you need to go all the way down to a neighborhood to actually look at some of these. And that's what we're doing with the ADA networks, is we give them back data at the city level, and then we can also go down to the census block, the neighborhood level, so they can begin to really see what's happening in each neighborhood and city on these participation disparities. So again, you're seeing here at the city level, where are some of the best cities in terms of the least poverty, the least unemployment, the most people getting out of that, out of the workforce and into the workforce. And here's the risk ratio, yet another way to translate knowledge that again shows what's the likelihood at the city level that people with disabilities will be living in poverty compared to people without. And this is just striking when you look at the bottom cities here. You know, Washington, D.C., again, 262% more likely that people with disabilities would be living in D.C. in poverty. Why should we care? Because in rehabilitation, if we're not actually addressing these issues of poverty, if we're not talking with people about it, we're missing the boat on where are they going to live, how are they going to live, what access to resources will they have, and will they ever venture out to participate. And then the third and last area I just want to share with you some of what we're looking at is community participation. So again, what key resources are people with disabilities getting access to be able to fully participate in the community? Again, housing comes to play here. No matter how we look at it and how we cut it, if you don't have access to affordable, accessible, and integrated housing, it affects overall participation. So we're able to map this for people and also convey this in accessible tables. What you're seeing here is a map of Cook County, the Chicago area. What you're seeing along with it, though, is showing you where people with disabilities are actually living in Cook County and Chicago. And behind that, you're seeing the darkest areas are the lowest income areas in Chicago. Also lowest resource access, right, as well. And so are you beginning to see the trends here that people with disabilities are largely concentrated in Chicago and Cook County in some of the lowest income areas? And so they're not able to get to the same participation that we would. The other thing we're looking at here in participation is how likely is it that people get housing choice vouchers, e.g. that they actually have access to integrated housing choice, which again, very important in post-Olmsted, versus public housing. And this is really interesting to be able to look at this, because I think a lot of people just look at how many people have moved out of the institution. But what we're not looking at then is, are they really in integrated neighborhoods? Do they have a choice over how they choose those neighborhoods? Are they able to live where anybody else would be, right? And so again, we can begin to say, you know, what's the probability that people with disabilities would have access to integrated housing via a housing choice voucher in these communities versus be steered over to public housing, which in many ways, at least in the Chicago area, continues to be very segregated, at least by class, right? Without choice. So again, you begin to see here the cities that are doing the best at getting out into housing choice vouchers for people, and those that are having some of the biggest issues with segregating them into public housing. Another way we can look at participation is we mine the walk score, which is a publicly available score primarily used by realtors, right, to market housing to people, to buy into that neighborhood as an indicator that you can move around that neighborhood easily. We use the walk score, and I think the walk score is really a misnomer, at least for the disability community is, because it's not about walking and it has nothing to do with accessibility. It's about how far away are key resources to you if you live in that community, which I think, and we at the ADA-PARC think, is as important an indicator for the disability community as it is for anybody else, right? So in this case, it tells me, are things like a pharmacy, a grocery store, a library, schools, hospital, within a quarter to a half mile of where you're living, which means you could easily access them. And so here again, we're seeing the cities in this case and how they score on these walk scores. The walk score is one that we can go all the way down to your zip code level with. And so often in the ADA-PARC, we'll get requests from the cities and the regions back to say, okay, give us the whole map of the whole city and exactly what does this look like. And so we can drill all the way down to that level. Nicely, the people who do the walk score also do something called a transit score, which is a combined index that tells you how available is transportation, public transportation. Again, we think this is as important to people with disabilities as it would be to anybody else, but a lot of people with disabilities don't even know it exists. So we're mining it here as a way to show you what's happening in the cities so that people with disabilities could be able to make a decision about, if I move into that neighborhood, how much access am I going to have to public transit. But we know transportation is a huge issue, and so we wanted to drill into that one much more deeply than what was available via these public scores. And so one of the things we did is we're working with our colleagues in urban planning, Janet Smith and Lauren Nolan, who are really noted for their analysis of urban planning in relationship to people living in poverty. And what they're doing with us is mapping what's happening in terms of transportation access at the level of the cities. And so this is a combination of census data. It's also taking all the data from the National Transit Survey and from the Department of Transportation on a federal level. And so what you see is, again, where people with disabilities are living. In this case, we're looking at Houston. And right on top of it, you're seeing where the train lines are, where public transportation from trains are actually located. And so you can see exactly which neighborhoods are not getting that access, which neighborhoods are. But the next thing we look at then is what's the percentage of people with disabilities that are living within a half a mile of a train stop, which when you look at public health data, you look at AARP's livable communities, that's what they're determining is an easily accessible distance to still be able to use that public transit. And so what do we see here? In Houston, Lex, you should be a little chagrined on this one. Within a half a mile of a train stop, only 5% of people with disabilities are actually living within that half mile. Although if we look at all of Houston and compare it to people without disabilities, we see only 4%. Let's keep going here, and we compare this to Chicago for a minute. Now we see in Chicago, and here's where Chicago is interesting because we've had a series of community activism lawsuits that have resulted in incredible changes in our public transportation that are still ongoing. So what we can see here is a big difference between Houston, even though we're large metropolis urban areas. Over 31% of people with disabilities in Chicago are living within a half a mile of a train stop. When we look at the bus lines, we begin to see access is better in the buses. So in Houston, it now jumps up to 52% of people with disabilities are living within a quarter mile of a bus stop because we want to have them even closer when we're looking at access to bus transportation. But we compare that to Chicago, and we see 94% of people with disabilities in Chicago are living within access of a public bus stop. So again, you can start to begin to see how you could use these things to benchmark, to compare in your cities what's going on, and to say, well, why is it that Chicago was able to do that, and then to link to the advocates and the policymakers there. This graphic also tells us, though, how we're still using it to improve things in Chicago. When you're seeing our train lines here, you're seeing actually them marked by blue means that they're an accessible train stop and station, and red means it's an inaccessible. It's not wheelchair accessible at this time. And so we're actually using this to be able to then target, and you see up here on our north side, which is actually one of the wealthier communities in Chicago, that some of those stations are the least accessible. And so we're actually using this right now in Chicago to do actions there, to coalesce as a group with the disability community, with our transportation policymakers, on saying, let's get this better, even better for Chicago. So different ways that you can use this data. Another way we're looking at it for community participation is not just access to transportation, but we also wanted to creatively look at access to disability resources. And one of the key resources that we all know about that's federally funded are Centers for Independent Living. And so what we did is we mapped where are they, and are people with disabilities within a 5-mile radius of being able to utilize these key information resource centers. And so you see in Houston, only 22% of people with disabilities in Houston are within 5 miles of a Center for Independent Living. If we look at it in the Chicago area, we see we're up to 43%, but it's still less than half of the percentage of people with disabilities are within 5 miles. This is actually being used by the Centers for Independent Living to say, well, A, how are we going to outreach to these folks? B, does this have implications for us doing much more tele or online kind of outreach that we could do as well with these folks? And they're using it right away to kind of say to policymakers, how are we going to extend our outreach? Because we know that, again, from the research, the more people with disabilities have access to being able to face-to-face network with the disability community, the more likelihood that they're going to be able to understand their participation opportunities, understand their rights, and be able to troubleshoot those and still be able to participate. So in this case, it's not only for developing online, but it's also for saying, how do we get people with disabilities into face-to-face networking with this community as well? Again, here's the benchmarking, or that scorecard, where you get to see across all these different community participation measures that we have, and you begin to see the cities, in this case, that are at the top and at the bottom of community participation access. Again, I'm just showing you a summary here. These benchmarks right now are just getting posted onto our website as a scorecard. So you'll actually see a score, like that 0 to 100 score. And you can actually click on any city or go to the table and see all the cities, and you can see exactly where they are relative to each other. So that kind of gives you a flavor for what the project's about. Some of our ongoing knowledge translation actions that we're taking right now, we're moving into the 5th year of our grant, is we've been updating the GIS data annually. In fact, we, again, just did a lot of updates to 2015 data if it's available. We are now have an open call to add cities, and the ADA regions that we're working with are sending us many more cities. And if you have cities in particular that you'd like us to explore, we can go ahead and do runs on those for you and give you that same data back. We've also had requests from the communities and the ADA centers to map intersecting disparities. So we've done now disability versus not disability, but now what we're going to be adding to that are maps on, say, income levels, poverty levels, disability by race and ethnicity, disability by age, gender, and hopefully some types of disability, although there's some restrictions given the use of census data, how far we can drill down on that. But that's the latest set of things that we're actually going to start answering research questions that the communities are now posting back to us again and again as they look at these maps, as they see it, and they take it back to their policymakers that they'd like us to explore and answer with them. We're also evaluating these new benchmarks, right, these scorecards that are now just getting posted onto the website. Will be done by December. You'll begin to see these, to see if they're being used, right? And we actually are really quite interested in this because AARP itself has been doing a lot on livable communities with benchmarks of them. They've not necessarily been that inclusive of people with disabilities, and at certain times have actually excluded people with disabilities from their criteria. and their website itself is not accessible. So part of what we're trying to, again, do here is demonstrate how can you make a website where anybody can get access to this information about livable communities and about community participation. And then our third goal is to be able to share the data with people with disabilities, ADA centers, these community advisory boards, and policymakers, which is something that is happening ongoing in this project. But we look to you to say, how do we then move it, beyond the ADA centers and their vast network, that they send it out to other networks? How can we even get this into, say, the hands of rehabilitation providers or other community organizations, or say housing providers or fair housing and legal rights providers, so that they can begin to look at this? And so one of the projects that Lex and I have been talking a lot about is, could Department of Justice be using this as well? And they're very interested in looking at how we're showing the data and mapping it, so that they could potentially also be using it as a way to screen accessibility and disparities related to it before they go in and do a detailed audit of that community for a litigation or a complaint level issue. So we're also looking at how could we use this with Department of Justice. We're also talking about with Department of Transportation and other federal agencies on how could they utilize this as well to benchmark their own outcomes. And then finally, the last thing that's happening with it as we speak is, because we are collaborating with the ADA centers, is that they are now networking people to resources. So when you go to these maps and you start to see you're not in the top 5 to 10, you're in the bottom 5 to 10, and you want to start to begin to figure out what could you do about it, that's what we're now linking people to, is immediately via the ADA centers, is technical assistance guides, resource guides, trainings, workshops that the ADA centers can then provide as the key link back to the community to actually get them to actually action plan and begin to address some of those disparities. There's a number of references that you can see here, although I would say just go to the website, and the easy way to remember the website is just type in ADA-PARC, PARC with a C, not a K, and it'll take you right there. You don't even need to know the long URL. And all of what we're doing on the website will link you back to the original data sources if you want to learn more about it. We actually give a summary in text to everybody about some of the limitations of the data as well. Like in a smaller community, are there some issues with this data or not? And so we try to begin to give people as much access to things as we can. And with that, I wanted to open it up and see if there were questions that you might have about the ADA-PARC project and all the different things we're doing for KT. I should also mention, though, in addition to the website and the data that I showed you, we're actually in the midst right now of doing a national transportation survey via the whole ADA network centers. That's actually going out to individuals with disabilities. So this is the individual take. What I was showing you is more the public health population level data, but we're also mining the individual data, and that transportation survey is open as we speak. So we can send you a link to that if you're interested in sending it out to participants that you know of to be able to evaluate public and private transportation in their arena. That'll then become a part of our website as well, so people can see the results in each of their cities. And the last thing we're doing is individual interviews with people from the Olmsted group. That is people coming out of nursing homes and institutions to the community, because to be honest, they're not represented in the census data. They're not a part of that. They're also not represented in the Nod-Harris polls because they haven't been living in the community. And so that's the other part of the KT that we're doing, is we felt we really needed to do some outreach specific to those individuals. And so each of our regions are doing about 50 interviews with people of different disability groups, intellectual and developmental, psychiatric, and physical disabilities, to actually see how are they doing in terms of community living, participation, and work opportunities. So we try to do it from many different angles, kind of triangulate the data, get it out there in different ways, And again, we're definitely open to any kind of suggestions you have for how to make the material even more accessible, even more valuable and usable.
While Anne is compiling some of the questions, let me simply add that one of the benefits of this technology that we have developed that we're using here is for planning, and the state independent living councils have just been updated on the progress we've made with this research project, and they are now beginning to use these data to target services. So in the case of the independent living centers, we obviously have many more needs than the centers have the resources in order to meet. But if they, and almost community by community and state by state, can understand where the gaps in services are or where the gaps in disparities are, they can target services to meet the greatest need. And I think that's one of the real benefits of what we're doing here. Anne, do we have any questions?
Yeah, I'm seeing there was a question about, are the sources referenced on where we're getting it? And yes, when you go to the website, it's referenced in detail way at the bottom in case somebody is the data wonk and wants to look at it. We also try to give a summary, though, just to tell you, is this reliable data or not? In some cases, you know, the data is too small, and so we will not report it, and we will say why we didn't report it, that it's just, you just can't rely on it. There's missing data or it's not available for that city. So you will see that there. We had another question on, is it on Twitter? That's been an ongoing discussion. Yes, Lex, right? Like the whole ADA-PARC network is talking about right now how to Twitterize all of this and how to link it to you know, social media, live action, social media kinds of things. And I love the idea. I think we spent most of our time on this first shot at it, mainly to say we wanted data that was accessible, that could be translated, and that was in a format that was usable by communities. And so now that we've got that, and we know the data is rigorously analyzed, e.g. it's not just something that you might stumble upon a website and not know whether you can trust it or not. Now that we know that we've worked out the bugs on all of that and we've gotten it very rigorous, that we can now begin to tweet it out. And we're also going to be doing some blogging on the website where we're actually going to be featuring how different cities that have promising practices got there, and also cities that have issues, what they're doing to act on it. So say transportation, an issue in Washington, D.C. and in Baltimore both. There's a local board right now that has just done a multi-regional transportation action conference being led by the ADA centers, and so we want to feature them to show people, why don't you connect with this group? They have the same problems you do, but yet they're starting to take actions on it, and this is how they're doing it. So we do have that available. There's a question on, can we do it by physical disability? And yes, Margaret, we do not have that posted at the moment. We wanted to get everything with and without disabilities first up and running, and so that's what we have up. Now the next set of things that we can now do is at least into the categories of American Census data, right? So yes, physical disabilities can be pulled out compared to cognitive disabilities at least. What that doesn't allow us to do, though, is look at things like people with psychiatric disabilities versus people with intellectual and developmental disabilities, because they are lumped into the same category. So there's only so far we can go with that existing data sets, but yes, and we've had questions about analyzing it by people with physical disabilities. We've also had questions that we're now doing on analyzing it by race and ethnicity. Several requests for, can we do it comparing Latino communities with and without disabilities to, say, a white Caucasian sample. And that's what we're beginning to run upon request for different audiences. We don't know how to show all this at the website, and you can imagine it's a KT challenge on how do you take all this and make sense of it, right? So what we're doing is running those runs by request of a community and sending it directly back to them and just talking them through it. So there's not overwhelming amounts of data on the website. But eventually we would like that, by race, by ethnicity, by type of disability, and by age and gender and economic status are our most requested runs that we're doing right now.
Let me interject that if those of you who are using Twitter and Facebook would like to make posts pertaining to this subject, use hashtag ADA and hashtag ADA-PARC, and we should be able to pick it up that way.
Yeah, and I see a question here about translation to Spanish. Yes, we are in the process. That's one of the things we are doing right now. And just to note, the transportation survey, though, is completely available in Spanish version. So we can post that to the group later on this afternoon. We'll put out the website contact for that you can get to it. And yes, translation for it is what we're doing exactly right now on that.
Well, both of you, thank you very much for that thoughtful presentation and answering all the questions that are coming up. It looks like we have one more. Oh, just accolades for the great data source and the effective visual representation of information. We heard yesterday about infographics, so this falls nicely as a continuation for this conference. We have about 7 minutes left, so we do have a couple more questions, a couple more minutes before we head into break, so if any questions are coming in. One comment that I was thinking was that the scorecard seems like a really useful tool to communicate with policymakers. So if you have actions or items that you'd like your local policymakers to think about and to change or make effective, that you could use this school scorecard for those policymakers. Have you ever seen that them used in that way?
Right. So we already are using it within the ADA-PARC. All the ADA regions that are with us have already taken it out to their community advisory board because we wanted to test it with them to even see did it make sense. Could they get it? And they're also helping us figure out how to show it on the website. So we're trying to figure out, is it like a report card or should it be like a windshield wiper, dial of how good you are or not? We're looking at AARP, which is doing it from kind of a dial from red to green, red being it's a disparity area to green being it's an opportunity area. And so that's what the community policymakers are helping us right now kind of vote on. Right, and so then that's what will be the mode that we present it on the website. And in fact, we'll probably present it in at least 3 different alternatives so that it's accessible to different groups, but that also they can get it in different visual ways. But so far, the response from the communities and the policymakers, and maybe Lex, you can talk more about what you've been doing specific to transportation policy and things. So far, it's been very positive. The visual maps are actually very compelling already. People are getting it, and they like to drill down, to their cities and their neighborhoods kind of thing with it, and are actually asking us to drill down all the way to zip codes and things like that. So I think they're getting it. We've even had requests for can we run it by political alderman district, because that's how resources, at least in Chicago, are often allocated and decisions are made, and so we're remapping that according to voting districts and alderman districts. And so they've been coming back to us with really interesting suggestions on how else that they would like to see the data. So I think they're using it, and maybe Lex, you can talk about the transportation actions that you're doing.
Yeah, just a couple of things. First of all, we are very concerned about the validity of the information that we're feeding back and the way we summarize it so that it will be in fact valid. We've received a lot of good feedback from our advisory groups about the face validity of the information we're providing, but we continue to assure ourselves through data analyses that the information we're translating into these benchmarks is truly valid and representative of the data. The point Joy mentioned regarding the use of these at the local level, we found one interesting kind of observation here. When disability groups take this information to local providers, in this case transit providers, we found that the transit agencies want to know the source of the data, and then they begin to, in several cases here in our region, we've discovered that the transit providers are finding the data so useful that they've actually gone back to the original source data and begun to replicate the process themselves so that they can use this in planning, not only for transit planning related to disability, but also transit planning related to other groups of people with specific needs, including those with low income. And that's where we see some of the great disparities in these cities with new systems versus more mature and well-established systems like Chicago. I thought it was really, really interesting that in addition to finding the information we provided on the face of it valuable, these agencies have begun to adopt our methodology in their own work. And this obviously provides an opportunity for the community to become engaged at a substantive level in the decision-making process and not simply to throw stones from the outside saying this was done poorly.
And there was a question about when we're talking about requests to run data, do we accept requests from independent researchers or research centers? And at this point in our project, it's the last year of the ADA-PARC, and of course we're gearing up to say, you know, could we take this into the future as an instant immediate website, right, where you wouldn't even have to ask us to run the data for you on this, but you would be able to do it online. So that's kind of our future of where we're headed with it. But right now, yes, we are indeed taking requests from independent researchers because we're trying to play with the data as much as we possibly can. Yeah. So for us, we are looking for requests. We are looking for additional cities right now. We may group you into an ADA region, just so you know, because they're also wanting the same data. So if you have a city and you're in a certain region, we probably will send out the outcomes and outputs over to your ADA region as well, because they're actually using it with the policymakers. And then, Jess, your point about I'd love to see case studies or reports from the field. Yeah, you know, I think that was the #1 request from the ADA centers is that we need to add that blog to the front of the website that actually highlights specific communities, right? And so we're in the process of starting to do that just for transportation promising practices and transportation efforts first. So that will be going up this fall, that we're going to be putting in a blog at the front page. So it's not quite so boring of a front page, and you actually see a specific community that's been working on this a lot, and you can actually hear about their story and then link to them. And then after transportation, I think the next one we wanted to take on was Olmsted Least Restrictive Living, because that one on housing vouchers seems to really be something that communities are quite interested in. And so that probably will be our second one, but then we'll take requests from the communities on which of these they want to feature. And the ADA centers actually love the idea because it would only put them in the limelight and be able to show exactly what they're doing out there.
Well, thank you very much, Joy and Lex. It was a pleasure to have you here this afternoon. It's time for our break, so I'd like to end here and again send you our warmest thanks and to let folks know that we'll be